Live from the Carl Chevrolet Studios in West Des Moines, this is Iowa Live.
Hey everybody, just want to remind you that the Animal Rescue League's Raise Your Paw auction is tomorrow over at Prairie Meadows. Tickets are still available at arl-iowa.org. Welcome back to Iowa Live, everybody. We have a very special guest joining us in studio right now. Dr. Naveen Gupta is here from ANP Foot and Ankle Clinic. Great to see you again, sir.
Great to see you.
Now, we're going to talk about what you treat at ANP Foot and Ankle Clinic, because you're very specific, aren't you?
Right. Yeah. We treat everything below the knee, but main focus is on the wounds that are not healing or that have been there for a long time. So that's where we focus our practice now for several years now.
Now let's talk about these wounds, and let's talk about how somebody would injure themselves from the knee down, because that is your specialty. What would cause some of these injuries?
Right. All the wounds on the below the knee are going to be some type of injury, unless you have varicose veins. That vein pops and all of a sudden you have a wound. But otherwise you're going to have some type of injury. You might have an ingrown nail, you might have bad shoes, you might have bony prominences on your feet, or you just don't have adequate support in your shoes that causes the skin to break down eventually.
Really?
And now you have a wound.
Now let's talk about the skin, because you and I were talking prior to the cameras turning on, and you said the skin is key, and the way the skin is on your body right now. Let's talk a little bit about that.
Right. So a wound is when the skin is broken down.
Okay.
Okay. If the skin is weak or skin is thin, which is what's going to happen when someone has a lot of swelling on their legs. Okay, if your leg is this big and all of a sudden with the swelling it's gotten this big, you didn't grow new skin to cover that big of a leg. Okay, so your skin is stretching out and it's getting thinner and thinner.
So the skin has the same density and everything, but then it's stretching out and it gets thinner and thinner.
It's getting thinner. When the skin is so thin and weak, it's the swelling from inside is also pushing against the very, very small blood vessels in there and causing the blood flow to be decreased to the skin. So if you bump that, like bump it on a table or a bed at night, that skin is going to break. That skin is going to pop, and then it can't heal, won't heal. There are a lot of different things that are going to cause. But until we can get that swelling down and bring that skin back to its natural thickness, and circulation is improved, that wound will not heal.
Didn't even think about the circulation factor with the swelling. Yeah.
So there are other factors. If you've got diabetes that is out of control, you've got circulation problems, all of these things are going to add to a wound not healing. But the main focus, first of all, is to bring that swelling down, control the infection, make sure things are clean, the leg is clean, the skin is clean, and the swelling is going down. Once that skin becomes to its natural or normal thickness, normal circulation is preserved, then we can talk about wound healing. And there are a lot of different things that we can do once we have that normal environment created for that wound.
Okay, I want to go back. You mentioned in case there is an infection. Now, with the blood vessels being restricted the way they are, that probably makes it harder for that infection to rid itself, isn't it?
That is correct. So, if the circulation is decreased, you can take all the antibiotics. If you don't have the blood flow going to where the infection is, the antibiotic's not going to get there. That's how the antibiotic gets to the wound place where the infection is. And if you don't have circulation, instead of one pill, you might have to take 4 pills to have enough concentration of that medicine where the infection is.
See, that's some of the things I never even would have thought of, and I think you may not have thought of that either. But the thing is, we have ANP Foot and Ankle Clinic right over here in West Des Moines. You have a chance to see people and figure out what is going on from the knee down. That is your specialty,
That
right?
is correct, yes.
Okay. Now,
yes.
people need to get a hold of you, and we suggest you do. If you have any kind of wound from the knee below, what's the easiest thing they can do?
Call the office.
Okay.
And it's 515-226-2189. Otherwise, you can go to feetdr.com.
Feetdr.com. It's a great website. Easy to remember that one.
Thank
and
you.
You can get everything taken care of, folks. So if you have a wound from the knee down, ANP Foot and Ankle Clinic, and Dr. Naveen Gupta is the guy who will take care of you. Thank you, sir. We really appreciate it. Thank you.
Thank you.